those in the video. All right, so we have the blood from head, neck, thorax, upper limbs that'll come in through the superior vena cava. Everything else from the bottom parts of the body come in from the inferior, and they come into this right side. Okay? And yes, that blood coming in is containing wastes. But now remember, that doesn't just mean carbon dioxide. Because you've got, for example, the kidneys themselves producing urea. Muscles can produce lactic acid. You've got other waste. You've got bilirubin. You've got all these other wastes that make it into the bloodstream. And when you go from the right side of the heart to the lungs, okay, the only thing there that they do is the CO2 and O2. But for the most part, we're looking at our gases. So now we have to make sure we can get to the kidneys, filter that blood out, get it to return to the heart, so that as the blood moves through the rest of the body, you're getting pretty good filtered blood. Okay?
So when it comes out, it's only oxygenated. The rest of the filtration process occurs in the kidneys.
Kidneys are going to receive a huge amount of that blood flow.
Okay.
So we look at it having these two circuits. All right? So the 4 chambers, the 2 circuits. And as we look at its position, because this is something that you'll hear terms about in your field, the heart is located in the mediastinum. Anybody ever heard that term? Okay, what does it mean?
Middle of your sternum.
Middle of our sternum. Anything else that it might mean? Okay. Do you remember from part 1 how it seemed like everything we talked about, whether you were talking about bone, muscle, or nerve, everything had connective tissue wrappings. And we created, or we have, these membranes that get created. The mediastinum is referring to that membranous partition between the lungs and the heart. So it is referring to the fact that it is a membranous partition. Because in this area of the body, the thorax, first of all, one thing to note, this area is encased in bone. When something's encased in bone, what does it tell us about what is underneath that bone?
That it's important.
The importance of it. Now, a couple of other things about having the heart, the lungs, part of the kidneys, protected in this area. We are looking also at organs that need to expand and recoil. And we do not need them to have an infinite amount of space to expand and recoil. Does that make sense? Also, because of the way that the structures are in this region of the body, and because, yes, there's a lot of fluid within these tissues, it can build up. Fluid can build up around both the heart and the lungs, both of which are not fun. Under normal conditions, the way that this structure is created within the thorax, having these wrappings, having their connective tissue wrappings around each organ, it allows them to expand and recoil without having to feel it every time it happens. It reduces the friction. So the heart is located within the mediastinum, within the thoracic cavity. Does that make sense? All right. So if we look at the shape, yes, usually about the size of a fist, okay, which would be different person to person, okay, but for the most part, very similar in size. We say that the structure has a base and an apex. It is backwards, all right? It's flipped. When I think of a base, I think of here, all right? But because the heart comes to a point, okay, not a sharp point, but it comes to a point, that is your apex. This is the base. The base is where we have entrance and exit of lots and lots of vessels that are present. So the apex is going to be that blunt, somewhat pointed in. It does tilt a little bit left. Have any of you ever had like ECG? All right.
No, but I've given plenty.
Huh?
I said no, but I've given plenty.
Given plenty. And you kind of put them here, okay? Because that's the point at which it's pointing, okay? Towards the left. And then here, okay? And then you've got other leads depending on what's required for the ECG. The size is about 3.5 inches at the base. It's about 5 inches from the base to the apex. The apex is about 2.5 inches going from anterior to posterior. And looking at this structure that we're going to see. All right, so what we're doing now is we're kind of looking at a cross section of our hearts. Okay, so think about what, even though it's not very well represented on these models, okay, but kind of look at it with me, okay, on these models. Pericardium. What does peri mean?
Around.
Around, okay? Peri means around. Guess what cardium means?
Heart.
Heart, okay? Now, in this picture, they're trying to show a representation of somebody holding like a balloon that's not quite full of air, putting their fist down into the middle of it. If you know anything about balloons, all right, and if you've ever like punched into a balloon or something like that, okay, you know that if you were to do that, the innermost layer of that balloon, okay, that innermost layer would follow the contours of your hand, okay? The outer part of the balloon would simply fold around it. And then you've got some space in between. This is what's happening with the structure of the heart, okay? It's going to be a lining that will actually run the contours of the heart and then create a sac around it. So what we're going to see is this double-walled sac that's enclosing my heart. That is my pericardium around the heart, okay? Note, it's trying to show us that it has the ability to be anchored. Because, once again, this is an organ within membranes within the thoracic cavity. So we're finding that having this structure helps anchor the heart in place. Once again, helping it to reduce friction every time your heart beats. Have you ever heard of pericarditis?
Mm-hmm.
Okay. Do you have patients that have it?
I get people with, yeah,
with the pericarditis?
yeah, we get a lot of patients with people like that, or endocarditis and all that stuff.
Now, in the case of like the pericarditis, are they in a lot of pain? Do they have to be given a lot, like the pain meds and stuff like that?
Though, because sometimes that's what causes, like the endocarditis.
Okay, the endo being the inner portion of it.
Yeah. Sometimes it's caused by injuries and stuff. So they are in pain, but they can't like get like the IV.
The relief from it. Okay. Yeah, I have been told that the pericarditis, which would be an inflammation of this sac, is extremely painful because you are now feeling your heartbeat every time it beats. And I've been told that that's extremely painful. So this sac, okay, we're allowing it to anchor to the diaphragm. Note, they're trying to show that here, okay? And it helps to anchor it to the sternum and gives a little bit of this isolation in this mediastinum of the thoracic cavity. All right? It's like a cavity within a cavity, if that makes sense. So, the outer wall, and note, they tried to show a blown up version of it over here, okay? So the outer wall, inner wall, okay? Parietal tells us outer. Endo or epi tells us inner, all right? So now we're going to see that we have on these layers that exist. The outer portion is termed parietal or pericardial, and it is fibrous because it gives fibers. It allows for the fibers to anchor. The inner portion, also known as visceral or epicardium, okay, this one is serous. What does a serous membrane do? It secretes a fluid. This is where we get that fluid inside of it, okay? And anytime like there's not enough, usually that's when we get the pericarditis. So we are in, like I try to keep saying, okay? We are in a cavity within these membranes within the thorax. So it's like the heart is, and it is, okay? It is in its little space to itself within this cavity. The lungs are too, all right? But very well protected. So pericarditis is something, is it very like, do you see it in a lot of patients, or is it usually less prevalent in the patients?
It's usually less prevalent. Like we don't see very often. We'll get a couple of people here and there. Like
So not quite as common as other heart issues. which I kind of thought that was the case, that